Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you so much for joining me, Ellen Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I am so happy to have on board as our guest, Dr. Michelle Thompson. Dr. Thompson earned her medical degree at Mount Sinai School of Medicine, right in New York. She completed her residency in internal medicine and fellowship in geriatrics at Montefiore Medical Center. And after many decades in private practice, Dr. Thompson discovered functional medicine, and she'll be sharing her information about that on today's show. This specialty explores all the dimensions of illness and suffering and offers interventions for the person as a whole by targeting underlying causes of different illnesses. In partnership with the patient, lifestyle, and treatment plans using natural therapeutics, Dr. Thompson has found her calling, along with the many patients that she's able to help. She is credentialed in functional medicine. She is board certified in palliative care and board certified in geriatrics. And her office is epicmedicine.org. And we will say hello to her now. So thank you so much for joining us today, Dr. Michelle Thompson.
Thank you for having me on the show, Ellen. I am truly grateful for this opportunity.
Let's go back in time and tell us how you became a doctor, or why. Like, what led you in that path, even from the time you were a little girl?
Oh, wow. That's actually a funny story, because I wanted to be a dentist. And I did a pre-med program at UConn when I was a junior in college. And under peer pressure, I decided to apply to medical school. But it was a natural calling, because I've always wanted to help people, and I've always wanted to teach. Those are my two passions. And entering medical school, I knew it was the right place to be, and it was the right thing for me.
So right at the beginning, you were excited about things like science and healing and, becoming a professional in healthcare.
Yes.
And so, that's not an easy thing to get into medical school. You have to do a lot of science before that.
Yes.
As well.
Chemistry, physics, biology, all fun.
Right. Well, it kind of is, because it makes you, to me, understand the workings of the world. And really, when we're doing good medicine, we are understanding the workings of the interaction of the world along with the individual, who you might consider a patient when you're a medical professional. So it all kind of fits together.
Yes, indeed.
And what made you then go into a specialty in geriatrics?
My transition from specialty to specialty has been interesting, because when I was at the tail end of my internal medicine training, taking care of the geriatric patients, I always felt like there was something missing. And when I did my geriatrics fellowship, I discovered there were many syndromes that afflicted the geriatric population that aren't addressed in the general internal medicine training program. And so we focused on syndromes having to do with cognitive deficits, functional deficits, end-of-life issue, better communication skills, and addressing all the needs of the geriatric population. And in caring for the geriatric population, I was exposed to a lot of end-of-life issues. And so I wanted to better care for these patients, so I became certified in palliative medicine. And it was my exposure to death and dying that led me to functional medicine, because over time I became increasingly burnt out from feeling helpless and hopeless, not being able to do more for patients. Oftentimes, physicians deliver the bad news, there's nothing more we can do for you. And internally, I felt like there was something more we could do for patients. And it was like a natural progression from specialty to specialty.
And now you're focusing in functional medicine. And I'm sure many of our listeners, and I do want to say hello to our listeners and remind you that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and today my guest is physician Dr. Michelle Thompson, medical doctor, and we're going to talk a little bit about her being a specialist in a kind of medicine called functional medicine. So let's go back to that topic, Dr. Thompson. What is functional medicine?
Functional medicine is a scientifically based approach to attempt to address the root cause of illness. And to do that, we take a detailed history from the patient. And that provides us with a timeline of different events, illnesses, all the things that are related to the body's response to stress or stressors. And we're able to identify what the predisposing factors are, what the triggers are, and what contributors or mediators of their illness are. We take that information and we put it in what's called the functional medicine matrix, which looks at the body as a whole. And we look at the body's GI tract and looking at the body's digestion, ability to absorb, looking at the body's ability to detoxify, its immune system, whether there's inflammation, energy metabolism, how well our endocrine system is functioning. So we look at the body as a whole. And after identifying the different areas of dysfunction, we use lifestyle as the primary intervention to reestablish homeostasis or to rebalance the body's system. Because once you remove what causes harm and introduces what heals, the patients will feel better.
So the thing that's really strange to me, Dr. Thompson, is every single thing that you said is not something like woo-woo or spiritual. I mean, spirituality is always part of any healing, but really it is the top level evidence-based medicine, completely proven. Things like diet and lifestyle. That's not just wishy. That is really what changes the chemistry.
Absolutely. And conventional physicians know this. However, they're not trained to educate their patients. They'll tell you eat a healthy diet, but they don't tell you what that looks like and how to do it and how to adjust your nutrition so that you begin to heal your body. So it's very important for the physicians to be first educated so that they can then educate their patients.
And really, it takes something like, working on yourself to understand that, tremendous change that can happen.
Absolutely.
And also, I'm sure with your patients, you don't just say eat healthy. What does that mean to you in terms of analysis and looking at all different individualizing factors?
Well, what that looks like, there are general core recommendations. A predominantly whole food, plant-based lifestyle is a healing diet. And for individual patients, we'll do laboratory testing to identify areas that they have insufficiency or dysfunction, along with the education about the basics. What are macronutrients? What are micronutrients? And eating in, depending on their body's needs, different proportions. And it's a journey and it's a process to unlearn what we've been taught all our lives and to learn what is healthy and what heals the body.
But also when you say the body, I know with functional medicine, we're looking deeply at the individual. And while one person may actually need to eat, let's say, a lot of high protein foods, other people maybe need to stay away from wheat. I mean, it's really individualized.
Absolutely. Oftentimes, we may need to remove certain foods that may function as allergens, or they may have food intolerances, such as lactose intolerance. And through the history, we're able to better identify what's appropriate for the patients. But we often need to remove gluten, things like soy, dairy, eggs, corn, those are common food allergens that gets removed. I actually had a patient email me the other day to say that just putting her on an elimination diet, she was able to reduce her gastrointestinal symptoms and lose 9 pounds in 2 weeks. And she's been trying to lose weight for a long time.
Now, it sounds so logical to me. Of course, I've been studying this for over 50 years. So besides the evidence, just in terms of logic, don't you think, Dr. Thompson, that certainly when someone has stomach issues, that the thought of what foods they are eating, since those items physically touch the stomach, should be incorporated into mainstream gastroenterology?
Absolutely. Absolutely. And, in mainstream medicine, there's also a lack of understanding of how stress and the different forms of stress impact the body's physiology. And we do need to be able to educate patients about eating healthy and to have mindful body awareness. You touched on, it's not just the physical body that we need to heal, but we need to heal the spiritual, the emotional, and mental body, because often we have physical symptoms when there's emotional, spiritual, and mental imbalances.
Yes, that's true. And even there's been a vast array of studies. And certainly when we look at the ancient systems like Chinese medicine, they talk about the different emotions sitting in different organs, such as sadness sitting in the lungs and fear sitting in the liver. And then when we get around to doing qualifying studies and evidence-based studies, we see like they're kind of always right. We can so often link, let's say, asthma to when a child's parents went through a divorce, things like that. We really do see those patterns.
Yes. And from a functional medicine perspective, we now understand the physiology of how these different stressors, these different types of stressors affect the body. And we have laboratory evidence to show to the patients, this is exactly where you're having areas of dysfunction. And in healing your mental and emotional state and using your healthy diet and lifestyle that we're learning, we can start to repair that.
So you're talking so much about things like healthy diet and lifestyle, which, is really true because that cures a lot more things than just popping a pharmaceutical. It would be nice if we could just do anything we want, abuse our bodies, and then get a pill and fix it all. I mean, that's kind of what the premise is, but unfortunately, it doesn't seem to work that way.
Well, the pharmaceutical industry, when you take a pill, they haven't gotten it exact that if you have high blood pressure, the pill that you take only targets the receptors that affects your blood pressure, which is why drugs have side effects. And so when we implement lifestyle, when we implement natural medicine, it's all healing. It's all healing.
That's true. And usually if you even use a specific, let's say, herbal therapeutic or food therapeutic, not only does it help what you intended it to help, the other effects are that it then also helps something else.
Absolutely, because the body is a whole.
And I hear things all the time, as I'm sure you have, to where you might have told, let's say, someone you mentioned doing a restricted diet where they're not going to eat wheat for a while. And then like the client you just shared. So the other effect was that she didn't come to you for weight loss.
Correct. Weight loss was, she had gastrointestinal issues. And the weight loss was a side effect, so to speak, or a benefit, because that was one of her goals, but it was not her primary symptom.
Right. It was not why she just came to you. And if you had given her just an antacid or something, it certainly would not have had that effect. And in fact, it could make the overall gastrointestinal problem worse.
Correct. Absolutely.
Now, you have a statement saying the standard American diet impacts 6 out of the 7 leading causes of death. That's a pretty strong statement. Tell us more what you mean by that.
The standard American diet is high in fats, it's high in processed foods, it's high in sugars, it's low in nutrients. And so those 6 reversible illnesses are heart disease, cancers, chronic respiratory illnesses, cerebrovascular disease or strokes, Alzheimer's disease, diabetes. These are reversible with lifestyle. And by lifestyle, it's predominantly whole food, plant-based diet. It's exercise or movement. It's sleep, stress management, and healthy relationships. Those are fundamentals.
And, that could mean a lot of things. By relationship, you don't always mean like a marriage relationship. It might be a work-related relationship.
Correct. Healthy, healing relationships. There's some people, and we know this, we just call it negative energy. When someone walks into the room or you have a relationship with a coworker and they're a negative person or they're an unhappy person, you feel that energy. That has an impact on our physiology.
Yeah, that's true. And, you wouldn't always think that in regular, let's say regular medicine, they don't usually think about that.
No, they don't.
Now, why don't they, do you think? Because these things are so well proven, is it so widely ignored in mainstream medicine?
That's a great question, and that has a number of different arms of responses. There's a political response, and there's the non-political response. And so in medicine, we're taught about the diseases, we're taught about the symptoms of diseases, and we're taught about symptom management with pharmaceuticals to try to prevent the progression of the disease, but we're not taught to focus on curative interventions. We're not taught about predominantly healing the body. And so most of conventional medicine puts a Band-Aid on illnesses. And so these illnesses will continue to progress. You may not experience the symptoms, but when it reaches the next threshold, that's when patients decompensate and have heightened levels of symptoms. It's just not taught. It's unfortunately an industry that the pharmaceutical industry has a lot of involvement and a lot to say. And a lot of other approaches, the research is dismissed or ignored in the conventional sciences and their literature.
Well, actually, I find a lot of it in the literature. I mean, anybody can do a search on PubMed or Science Direct, let's say about any herb at all. Just go there, it's free. Any of our listeners could do that. And there's a vast array of really in-depth, very often placebo-controlled, double-blind studies done in the United States. So it is in the literature, but I do agree with you that it's not taught in the medical schools or pointed out to physicians, although it is there.
Right. So let me correct my last statement, refine it rather, that it's not in the conventional literature that's commonly referred to in their practices. So, for example, JAMA is one of the journals that are referenced, or the New England Journal of Medicine may be referenced. So we're not taught to look at Science Direct. And so we go to what we are familiar with.
It's true. And then, of course, it's downplayed if you ever go to a conference, most of which are supported by the pharmaceutical giants.
Yes.
So one of the things that's most disturbing to me at the moment in terms of the political ramifications in natural medicine is that there's actually a really repressive regime that's coming on board, which has been around I've been in this for 50 years. It's been in the background, but just recently it's become very aggressive, where they really don't allow you to say publicly some things that are known and even proven to be curative. And they're taking, in fact, a lot of physicians that do talk about those things, let's say off the air if they're doing a radio show like this, or taking their Facebook page down if they share it there. So there's really an environment of repression. And I think that's because so many people are finding their ways to natural.
They are. And in our current climate with COVID, a lot of people have sought alternative options rather than conventional medicine. Supplements were in high demand, actually have been and continue to be in high demand. And the functional medicine laboratories were just getting slammed because there were such an abundance of patients looking for natural options to heal themselves and to boost their immunity.
That is so true. So what about something, I mean, you definitely have so many years of experience with older clients, and it seems that dementia, what is the difference between using that word dementia and Alzheimer's? Help us understand that.
So dementia is memory loss, and Alzheimer's is a type of memory loss. So there's different types of dementia. So Alzheimer has to do with certain protein deposition in the brain. Vascular dementia, for example, is related to strokes. So there's other types of dementias. That's the fundamental difference.
So that's interesting. So dementia is a larger category. Correct. And within that, Alzheimer's is a subset. Mm-hmm. With specific, like you yourself would have certain diagnostic criteria. Mm-hmm. What was interesting, I think I saw on 60 Minutes a couple weeks ago, and as we know in medicine, there's always new updates and things are changing. And it was an interesting piece saying that in terms of those plaques that mm-hmm. they found, they did a study on people who had lived very long. It was a long-term, longitudinal study. And they found that it's not always the case. They're starting to question that belief because they found many people with lots and lots of plaque on autopsy who never had any kind of memory issues. And the opposite was also true, that people with, even advanced memory issues did really not have a significant amount of plaque. So that relationship might be, not necessarily causative. We don't know. That's an evolving process.
True. Correct. That is.
But how would you deal with that? Since so many people deal with anything from, let's say, a senior moment. Mm-hmm. I mean, I'm 70. I've had a few of those where, I know something for years and I suddenly can't grab it. Versus, of course, something much more severe. But how would you deal with that in functional medicine?
So in functional medicine, it's not important to look at the label, but it's important to look at the cause. So when we look at the brain, we want to know, is there brain inflammation? What is the level of the healthy neurotransmitters? Has the brain had access to the cofactors required for those biochemical reactions? How is our mitochondria, our powerhouse of energy production, functioning? Because we also know that when there's an inability due to high oxidative stress that damages DNA and damages the mitochondria, that we're not able to think clearly, and we can have memory loss and brain fog. We look at exposure to toxins that damages the nerve cells. So there's a number of different things that we look at to address the cognitive impairment as a category.
And how would you assess some of those things? Like, how would you assess what neurotransmitters may be present or may be deficient?
It's a simple blood and urine test. We also look at the body's stress response, because that too depletes the body's neurotransmitters and cofactors. And of course, illness and healing begins in the gut. So we have to see what's going on in the gut. Is there gut inflammation? If there is gut inflammation, there is brain inflammation.
So describe how a normal visit with you would be. And I'd also like to remind our listeners that, of course, you're available for telehealth conferencing, right? Not only having to come to your office. And spell your website for me.
It's EPOCHE, epicmedical.com.
Oh, so it's .com. I think we might have .org there.
Sorry, correct. .org. I slipped. It's .org, correct.
Oh, is it .org? Okay, that's how we have it. That's good.
Epicmedical.org.
Okay, and we'll have that posted.
Epic comes from the Greek word epoche, which means suspension of judgment. So
Oh.
it's not important to have the labels, but to have a deep understanding of the dysfunction so that we can work towards healing in a non-judgmental environment.
So how would that be in terms of, let's say, an intake to work with you? Because obviously it's not going to be 8 minutes in and out and here's a drug.
No, the first visit is usually about an hour and 15 to an hour and 30 minutes. And the patient provides a complete medical and symptom questionnaire, social history questionnaire, family history questionnaire prior to their appointment. I spend about 45 minutes reviewing that in great detail. So at the time of our visit, we dive right into it. What's been happening with their bodies from their prenatal history to current. And we generate the timeline. I'm looking to identify their predisposing factors, whether it's environmental or genetic, what triggers that may have activated their illness. And that could be food, infection, inflammation, illnesses, accidents, traumas. And we're looking for mediators of those illnesses. And that could be unhealthy, stressful relationships. It could be work. It could be a partner. It could be a child, caring for a child or caring for a parent. And how their lifestyle is impacting their illness and mediating that illness and what we can do to reverse it. Once we identify what some major components that we need to go diving deeper, we'll do some testing. And we'll look at their body's stress response. We'll look at their gastrointestinal tract, if there's inflammation, any issues with digestion and absorption, their body's ability to detoxify, if there's any heavy metal toxicities. And we'll look at their nutrient profile. And based on these basic information, sometimes they need more in-depth testing, such as their thyroid function and looking at other hormones, but their history guides us what needs to be done.
Well, thank you so much. And that would be a fascinating process. And what's wonderful is I know you went into medicine, Dr. Michelle Thompson, many years ago, earning your degree at Mount Sinai to be a healer. And through functional medicine, you have actually found that that is the best path to bring healing to your patients. So I want to thank you so much for being our guest today.
Thank you, Ellen. This was a treat. I appreciate it.
And I want to thank you, listeners, for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us again next week for another edition of Herbally Yours. Until then, stay healthy.